Together we achieve victory over heart failure.
Hello and welcome to our podcast. I am Dr. Prashant Kashyap, DM Cardiology, and I am practicing at Begusarai district of Bihar. And today we'll diving into a silent epidemic that India is combating, which is heart failure. In India, the majority of patients grappling with heart failure are surprisingly young individuals. It's a common occurrence in to witness young adults seeking medical assistance for heart failure, unlike the Western countries where heart failure is predominantly a disease of the elderly. Let's break down five essential insights into the heart failure. Firstly, what does it mean when a doctor tells you that you have heart failure? When people get a diagnosis of heart failure, they think it's the end of their lives. The term heart failure can seem frightening, though it simply means your heart is struggling to pump blood as efficiently as it should. The ejection fraction, or EF, measures how well your heart pumps blood. It is the amount of blood pumped out of your heart's lower chambers, which are called ventricles, each time it contracts. While a normal EF is around 50% to 70%, individuals with heart failure typically have an ejection fraction or EF of 30% or lower. Secondly, why are so many Indians affected by heart failure? So here the genetics play an important significant role. Indians are genetically more vulnerable to cardiovascular diseases. Furthermore, comorbidities like hypertension, diabetes, obesity, smoking habits, these worsen this epidemic or heart failure. Moving on to what are the signs and symptoms of heart failure. So watch out for confusion, easy fatigability or fatigue, palpitations or feeling of one's own heartbeat, nausea, difficulty in breathing, generalized weakness. There is also loss of appetite or vomiting in severe cases. So how can we protect ourselves from this disease? Our hearts work incredibly hard to keep us alive. These are five golden rules we can follow to return the favor. First is early detection of heart failure through regular blood tests, dietary adjustments to maintain heart health, incorporating daily exercise into your routine, practicing stress management techniques, and quitting alcohol, tobacco, and smoking. Lastly, what comes next after a heart failure diagnosis? Thankfully, medical science offers numerous treatment options. It is possible to lead an enjoyable, meaningful, and productive life. Heart failure medications improve the quality of life and the longevity. Devices are also available like biventricular pacemaker, implantable cardioverter defibrillator, and heart valve repair or replacement. And as a last resort, treatment option is heart transplant. So the lifetime risk for congestive heart failure is around 1 in 5 individuals for both men and women. So just remember, awareness and proactive measures are key in combating this silent epidemic. Thank you, everyone.